Hello guys, congratulations on entering a medical school, and this video is dedicated to all those first year students out there who were exactly like me, clueless, confused and scared what the MBBS journey is going to be like. And this video is dedicated to all those first generation doctors in the family who don't have any medical background and need an elder brother's guidance who has already been through the rough roller coaster journey known as MBBS. So here I am. My role is to guide you step by step what to learn, what to do during the first year MBBS in your college. So before I get started with the academics, I want to talk about your mindset first, because you have just cleared NEET UG and you are in that euphoria state that yes, I have worked very hard for NEET UG, I have studied with my full potential and I have finally got a seat in a medical college. So you definitely will be on cloud 9 right now. When suddenly you come across these new terms called brachial plexus, fascia, supination, pronation, and whatnot, you suddenly start feeling like a dumb child. I had studied biology in so depth. Why am I not able to understand anatomy? Why am I not able to understand the physiology? And biochemistry, though, it goes like on top of your head. So your initial days of your MBBS phase will feel like a nightmare to you, because now you are in a new place. You need some time to get adjusted to the food habits, get adjusted to the climatic conditions of that place, and also you need to understand whatever the professor is trying to teach you. So there's a lot going on during the initial days, and you will also have this pride of wearing the white coat and the stethoscope for the first time. You're not a doctor yet, but still you have completed the dream of your parents who were always wishing to see you like that. And it was the same for me as well. In my first physiology lab, we were given the stethoscope to measure the BP. This was the photograph my friend had clicked during my first day MBBS. Looking at this picture, my parents were really proud, but there was a lot going on in my mind. Am I in the right place? Because I'm not able to understand anything. All the terms are new for me, all these massive books which I'm not able to understand even a single word of which. I have no idea which one to read anatomy from, which one to read physiology from, and I'm not able to understand the words written in those books. Nothing was going in my mind, and I'm definitely sure you guys might have also faced the same thing during your initial days, and you're still not able to get on track. You're still not able to figure out what books to read, how to understand the anatomy, how to understand the physiology, and you're just trying to mug up word by word. But please don't make this mistake of mugging up each and every word of your subjects, because that will be the biggest blunder you are going to make. Because until now, even for your NEET UG preparation, you might have studied like this. Memorizing each and every word, whether it makes sense or not, just memorizing the MCQs. Until now you never focused about the concepts. अच्छे से रट्टा मार के you have cleared your NEET UG and you have entered a medical school. So now you have to let go of that habit. The earlier you let go of this ratta marne wala habit, the better it is for your future. Because once you start having the clinical postings, you are dealing with live patients, right? There you need to analyze the symptoms and come to a diagnosis. There the patient won't be coming with the four options. I have cough, which of the following is my diagnosis? No, right? So you have to use your clinical knowledge, your anatomy, physiology, biochemistry knowledge, and integrate it with a medicine knowledge to diagnose the patient. So your goal during first year is really simple. You just need to focus on the three subjects which is taught in the first year, that is your anatomy, physiology, and biochemistry. Some of your seniors might say, no, you have to prepare for NEET PG from first year itself. Absolutely not. You cannot prepare for NEET PG from the first year. You don't even know the basics. How are you gonna, solve the MCQs? How are you gonna analyze the MCQs first? So no NEET PG preparation during the first year. Keep this in mind. Promise me you're gonna enjoy your first year. You're gonna go out with your friends on weekends. You're gonna explore the new city. You're gonna plan a trip. You're gonna party a lot, and along with that, you're just gonna study for 2 hours daily. I'm not expecting you to study 8 to 10 hours a day. I'm not expecting you to start your NEET preparation from first year itself, it's absolutely bullshit. It's not the right strategy to start preparing for NEET PG since the first year. See, your first year is the foundation phase. The stronger your foundation, the stronger your further subjects will become. Because I had made this mistake and I have realized it during my internship and during my NEET PG when I had got my rank of 1.22 lakh. That was when I realized the importance of the first and second year subjects, and I had to start from the scratch. And I realized that only if I had focused a little bit on the basics during the first and second year, well, my story would have been different. So that's why I'm asking you to follow this. So what are you supposed to read? See, each and every one of you are in the same boat now. Whatever your NEET UG rank may be, whatever biology, whatever physics, chemistry, now is not the time to dwell on the past, because now you're starting a new chapter. You have to forget whatever you've been through during your NEET UG. Now, each and every one of your colleague is now in the same boat. They're now starting the same race. Some of you might have a doctor sibling, some of you might have a doctor parent. So that will be an advantage for you. They will be your guide. But what about someone who's a first gen doctor? You have no one to guide you. So I'll be the guide for you. Don't worry, because I was a first gen doctor and I know what struggles we face. So what are you supposed to do? No one is expecting you to learn Gray's anatomy word by word before your exams. What do you need to do? You just need to have an orientation of what structures are where. And this is where the dissection hall plays a very crucial role. For any reason, do not skip your dissection posting, because that's the most fun part of anatomy.
अरे बहुत बस भर रहा है यार.
And make an incision on the muscle and you enter the abdominal cavity.
अरे हट ना यार, कुछ दिखाई नहीं दे रहा.
You will be in a group, you will be looking at what the professor is dissecting, you will be discussing among yourself, you'll be having some gossips, you'll be the dissection environment is really different. You're going to miss it a lot, and you're going to learn the most anatomy in your dissection hall itself, because you're going to see the structures live. And when you read the book, once you have seen it live, you remember it better. And without attending the dissection, if you directly go and try to read Gray's anatomy, you will understand nothing. So for anatomy, try to see as much structures as possible during your dissection hall, and go back and read whatever you have seen during the dissection hall from Gray's anatomy. So you can refer to BD Chaurasia as well, but Gray's anatomy is the standard book. So I suggest you to refer Gray's anatomy first. And for your exams, you can just read BD Chaurasia during the last 1 month during your exams and pass your anatomy. But if you really need to build concepts, if you really need to strengthen your imagination power, I suggest you read Gray's anatomy, or you can refer to Netter's anatomy. And also have the 3D anatomy app in your phone. There are a lot of free versions available, so you can just download it and just play with the app. By looking at the name of the muscle, the name of the nerve multiple times, it'll be kind of a spaced repetition for you, and you will remember the names better, because that's the most difficult thing, right? To remember the names of muscles, the names of artery and nerve in the anatomy. And when your professor suddenly asks you a question during viva, let's suppose he gives you a bone and asks you the name of the bone, there are a lot of chances you can utter words like fibia, tibula, and whatnot. You can also watch the anatomy videos which are available for free on YouTube and learn as much as you can. You just don't have to rely on the standard textbooks if you don't understand. So the rules are simple for anatomy. You're not supposed to skip the dissection. You're supposed to refer from standard textbooks like Gray's Anatomy and Netter's. And only during the exam is when you'll read the BD Chaurasia or any other Indian author textbooks. You'll download the 3D anatomy app, and also you'll supplement the knowledge by watching the anatomy videos on YouTube or Telegram. So your main focus has to be to strengthen your imagination power, to visualize what structures run through your body. Once you develop this strong imaginative power and strong visual power, your clinical subjects like surgery, orthopedics, and even medicine are going to be really strong. And the next subject would be physiology. See, physiology can be really interesting once you start to visualize what happens in your own body, and when you start to relate it to day-to-day activities, like for example your normal respiration procedure. Once the diaphragm is pulled down, there is negative pressure inside your lung, inside your chest cavity, right? So you suck air, and once the diaphragm is pushed up, the pressure inside increases, and you exhale the air. So you can understand this better by looking at a syringe. When you pull the plunger down, there's negative pressure inside, built inside the syringe, and if you immerse it in water, it's going to suck water inside. And if you push the plunger, the pressure inside increases, and it's going to expel whatever is inside. So you understood respiration with the simple syringe experiment, right? So you can understand each and every process of physiology by relating it to your day-to-day activities, or you can even imagine that it's happening right now in your body. So to learn physiology, you can refer to the standard textbooks like Ganong's Guidance, and to pass the exams, you can read the Indian authors like A.K. Jain. But your main focus has to be on learning concepts, because once your anatomy and physiology are strong, believe me, all your clinical subjects will start making very much sense to you, because now you know the normal anatomy and physiology, right? You will now know what is the disease which can occur if something goes wrong in that process. So all your system wise diseases, you'll be understanding them very well once you're well versed with anatomy and physiology. And you can also watch the simple animated videos which are available on YouTube for the respiration process, the digestion process, for excretion, for muscle physiology, and for CNS physiology. You can get every video out there on YouTube for free. You don't have to pay anything, but you need to have a little bit curiosity to learn. And the subject which everyone feels the most difficult in first year, that is biochemistry. Well, it's actually not that difficult if you understand the flow of the cycles or stepwise pattern of what can happen. You find it difficult because you're trying to memorize it word by word, and that's absolutely not possible for biochemistry because it's so complicated to memorize. So I want you to understand what happens in the metabolism of your fats, lipids, carbohydrates. I want you to understand how the different cycles work. Once you read the cycles, I want you to, practice on your own without looking, and see where you get stuck, what step you get stuck. Then again look at the textbook, and try to complete the cycle on your own. So this way you'll understand the cycle better, you'll remember the cycle better, and you don't have to keep mugging up the metabolism cycles. And to understand this better, I want you to watch my video on the Pomodoro technique, which I had followed during my NEET PG preparation. And you can try this method as well to understand any concept better and have a long term memory of it. So yeah, these are the three subjects which you are gonna focus in your first year, and you are not supposed to prepare for your NEET PG right now. Your main aim is to gain as much conceptual knowledge as possible and build a really strong foundation. Attend all the lectures, ask your doubts no matter how stupid it may seem to you. Have fun while learning, and enjoy your first year MBBS as much as possible. These golden days of your first year MBBS are now never gonna return back. So enjoy this process of being a doctor, because you are not a doctor yet. This is your first step, and I don't want you to ruin this precious time of yours by just studying. 1 to 2 hours per day is sufficient. Learn as much concepts as possible, watch videos from YouTube or read your standard textbooks, and try to make a concise notes whenever you read. And this is the time when you strengthen your imaginative power and visualization, so that it will help during your upcoming years in your second year and third year to strengthen whatever you have learned in first year. And eventually when you start preparing for NEET PG during your third year or final year, you will already be ahead in that race for NEET PG. Because if you start preparing for NEET PG right in the first year MBBS, it'll be like having your foot in two boats at the same time. You're not making progress either in your NEET PG or in your first year prof exams. So you will be stuck in this loop of exams, and later these first year subjects will be a burden for you. So take it slowly, take time to settle down, because you are in a new city. Most of you are going to be in hostels. You may not like the hostel food, you may not like the climate in the city which you are in, and I want you to make a strong bond with your fellow MBBS students and your seniors, because these are the ones who are going to be your family for the next 5.5 years. So prioritize making a strong bond with your friends and your seniors before you even start beginning your preparation for NEET PG or studying, because the hostel is going to be your second home. And most important thing, don't forget to interact with your seniors. See, each and every college has its own culture of how the senior junior interactions happens during the first time. And we don't call it ragging exactly, but sometimes a few seniors may cross the line, and if anything feels wrong, if you feel someone is crossing the line, then you can definitely report it to the institution. But there may be a few ups and downs during the interaction, so make sure you're polite, make sure you are not rude to your seniors. Don't be scared of interacting with your seniors, don't be scared of approaching your seniors, because they're going to be like your elder brother for the next 5.5 years. For your every tiny problem in the hospital, in your hostel, those guys are going to be the first to come and help you. It's not going to be your batchmates, it's going to be your immediate seniors who will be backing you if you need anything. So make sure you're polite in the initial days, make sure you respect them in the initial days, and once you have a strong bond, then you can be as friendly as possible with them. So make sure you have a most memorable first year. Make sure you learn as much as anatomy, physiology, and biochemistry as possible. Make sure you have created a strong bond with your seniors and your colleagues, and make sure you have explored the city which you are in on every weekend, at least once every 15 days. I want you to have good memories during your first day MBBS, and not just sitting in a library and studying for 8 to 10 hours a day. Because believe me, later on, all you're gonna be doing is just studying. I don't want you to be missing the golden days of first year. So that's it for today's video. And please make sure to share this to your fellow first year MBBS friend who's also in a dilemma whether to prepare for NEET PG or whether to just study the three subjects. And also tell me in your biggest fear of first year MBBS in the comments, and I'll reply exactly like an elder brother should. And don't forget to subscribe because a lot of interesting and informative videos are on its way. Thank you so much for watching.